Come in. Hi, Cameron. I'm Angel. I'm your student nurse. I'm going to be doing a head-to-toe assessment on you today. But before we get started, I'm going to provide some privacy and gather my supplies. Okay? Provide the patient with privacy, hand wash, and gather supplies. Hey, Cameron. I'm back. I'm going to ask you a few questions. Can I have your wristband, please? Can you state your full name, please?
Cameron Pop,
All right. How about your date of birth?
11/20/1992.
And today's date?
Today is July 14th, 2015.
And do you know where you're at?
Yes, Rasmussen College.
Okay. I'm going to just be touching on your back just for a moment. So you'll just feel me touching on your spinal area, okay? Patient's posture and hygiene are good. Patient's cognitive ability is alert ×3. Okay, next we're going to be starting with the assessment of your face. Okay. To begin with, I'm going to have you close your eyes, and I'm going to be touching part of your face. And also, Cameron, keep in mind, if any part of the assessment you feel uncomfortable, please let me know. All right, go ahead and close your eyes and just let me know where you feel me touch.
Left cheek, right cheek, forehead.
All right, excellent. Open your eyes. Okay, can you raise your eyebrows for me? Okay, very good. And puff out your cheeks. All right, facial movement is good. No apparent redness or discharge from eyes or nose. Nose and ears are symmetrical. Can you give me a big smile? All right, excellent. Next, Cameron, I'm going to take a look inside of your mouth. If you could open your mouth and stick out your tongue. All right, now lift your tongue up. Okay, perfect. Teeth are good, and mouth is wet and pink. Next, Cameron, I'm going to be taking a look at your ears. I'm just going to lift up your hair. Okay, now the other side. Okay. No visible cerumen. No apparent lesions or discharge. I'm going to whisper in your ear. Just let me know what you hear, okay?
Orange, apple,
Okay. Excellent. Next, I want to test just your breathing in your nose. If you could lift one finger and hold your nostril like that and breathe in. Okay, and then on the other side. Okay, perfect. Next, we're going to be examining your eyes. So if you could focus on the back wall there. I'm going to be first running a light through your eyes. Okay, first on this side. All right, and now on this side. Okay, excellent. And if you're still looking at the back wall, and now focus on my finger. Okay. Pupils are equally round and reactive to light and accommodation. Any questions so far?
no sir.
Okay. Cameron, next I'm going to be listening to your breathing sounds. Each time you feel the stethoscope touch your skin, if you could breathe in through your mouth, breathe in and out of your mouth. I'm going to also be putting the stethoscope underneath your shirt. Okay. Would you mind lifting your shirt up for me? Doing okay?
Yes.
All right. Okay, excellent. If you could lift your arm up here for me. Thank you. Okay. Okay, perfect. And your other arm. Okay, Cameron, I'm going to be moving around to your back. Same thing when you feel the stethoscope, if you could breathe in and out of your mouth. And last one. Perfect. Thank you very much. Patient is not barrel chested. The anterior posterior to transverse ratio is 2 to 1. Lungs are clear. Rate, rhythm, and depth are adequate. Hey Cameron, okay, next I'm going to be assessing your heart. And I'm just going to be touching on a few areas of your chest. You can breathe normal. Okay? The first area that I'm listening to is just right of the sternum on the second intercostal, which is the aortic. Then I'm going to move across also on the second intercostal just left of the sternum, which is the pulmonic. Then I'm moving down to the third intercostal left of the sternum, which is Erb's point. And then I'm moving down to the fourth intercostal just left of the sternum, which is the tricuspid. And then I'm moving to the fifth intercostal on the midclavicular line, which is the mitral. Upon assessment of the heart sounds, no abnormalities were detected. Okay, Cameron, next part of this assessment will be on your abdominal area. If you could remove your shoes and lie flat on your back. Thank you. I'm going to be listening to your bowel sounds, and you're going to feel my stethoscope touch. And I'm also going to be palpating or touching your abdomen. And if you feel any pain or discomfort, just let me know. Okay. Assessment of bowel sounds will begin in the right lower quadrant. Then I will move into the upper right quadrant. And then to the left upper quadrant. And then the lower left quadrant. Okay. Next I'm going to be palpating. Again, let me know if you feel any pain or discomfort. Right lower quadrant. Right upper quadrant. Left upper quadrant. Left lower quadrant. When was your last bowel movement?
This morning.
Okay. Did you have any complications or concerns?
No, sir.
And how about urination? Do you have any complications or concerns there?
No, sir.
Everything's good? Okay. Assessment of patient's abdomen shape is good and normal. Assessment of bowel sounds are normal. Okay, Cameron, I'm going to continue with your assessment. The next part of the assessment, I'm going to be assessing your pulses. I'm going to be starting with the dorsalis pedis pulses. Pulses are strong and symmetrical. Then I'm going to move to the posterior tibialis pulses. Pulses are strong and symmetrical as well. Then I'm moving to your radial pulses. Radial pulses are strong and symmetrical. Then the brachial pulses. Brachial pulses are strong and symmetrical. And then I'm going to check your carotid pulse, which is right under here. And do one at a time. And now the other side. Carotid pulses are also strong and symmetrical. Okay, thank you. Next I'm going to be assessing for edema. And I'm going to be palpating lower extremities, feeling for warmth and looking for redness and inflammation. The lower extremities do not show edema. I'm going to do the same to the upper extremities. Also checking temperature and redness. Upper extremities do not show edema. I'm going to do some strength tests with you next, Cameron. If you could push against my hands Okay. And now pull your toes towards you. Okay, excellent. Okay, go ahead and have a seat up for me, please. Okay. I'm going to be checking your range of motion. So if you could look to your left. Okay. And now your right. Okay. Now look up and down. Thank you. Hold your arms up like this and rotate your wrists. Perfect. You put them down. And now do the same on your ankles. Rotate your ankles. Okay. I'm going to be testing your strength. Go ahead and put your arms back up and push against me. All right, now pull towards you. Okay, go ahead and put them back down. We're doing the same with your legs. Pull against me. All right, now push out. Okay, I'm going to be going here where your knees. Go ahead and push in. Okay, perfect. Now push out. Excellent. Okay, go ahead and hold your arms out like this. Go ahead and push up. Very good. Now push down. Okay, leaving your arms out like that, go ahead and rotate them for me. Okay, leaving them now out. Take one arm and go behind your back. Okay, back out. Same with the other one. Back out. Okay, put your arms down. Excellent. Go ahead and stand up. Okay, can you close your eyes for me? Okay, excellent. Open them. Now I'm going to have you take 3 steps towards the counter and then 3 steps back. Okay, and now back. Okay, and have a seat. Okay, upon assessment of patient's range of motion and strength. Strength is good, range of motion is also good, and balance is good. That concludes our assessment of the head to toe. Cameron, I appreciate your cooperation today. Go ahead and make yourself comfortable. I'm going to provide a call light for you if you need anything else or should you have any other questions. I'm going to provide patient with privacy and hand wash and document my findings.